Hi, my name is Professor Andrea French, and today I'd like to talk with you about safety when dealing with a potentially violent patient. We're going to learn a little bit about what nurses can do to protect themselves, their coworkers, as well as other patients to be safe in these situations, and the patient that we're handling to also keep them in a safe environment. I'll be providing some tips that I've learned from my experiences working in the ER, the OR, and the nursing home environment working with Alzheimer's patients. And as you may have heard, during this current COVID-19 pandemic, there's been an increase in mental health emergencies in all communities. So this is another reason why lessons on how to safely care for patients who are in crisis is really important. So let's look at this first slide. This is our agenda. We're just going to quickly cover what we do every day. It's the nursing process. You may have already done your class and had some practice with putting care plans together. So as you know, our nursing process includes assessing our patient, planning for the care that we're going to provide, also known as doing your care plan, and implementing those interventions, and then evaluating how well the patient is doing with the plan of care that we put in place. We're not going to cover interventions and evaluation today, but looking at assessment, we're going to look at what we look at in the chart, reviewing the patient's history, the observations that we can do, and our clinical observations, and talking with your patient. We're going to go over planning for maintaining a safe environment for you and also, again, the patient. Okay, so let's look at how do we do a thorough chart review. What this does is it helps you anticipate what might be a common behavior in your patient. That's what nurses are trained to do. You will learn to do as you get better further along in your nursing practice. What it helps you realize is what's outside of the norm for that particular patient that you're dealing with. And once you know what behaviors might be typical for them, it'll help you remain calm when they do exhibit them. And remaining calm also helps to engender confidence in that patient, in your ability to care for them. Okay, anticipating is highly valued in what we do. Okay, now what you also want to do with knowing this history is that's where you can tell your preceptor when you might feel overwhelmed from what you're seeing in the patient's either recent history, are there psychotropic meds that you're unable to manage. Not all patients that are on psych medications are on the psych ward or a psych floor or a behavioral health unit. They might be on any floor. Okay, so in the history that we review, we want to also look through the chart and see if there is a history of previous hospitalizations where the patient assaulted another staff member or a family during the hospitalization. And of course, if a patient comes to the hospital escorted by local police guards of some sort, and they remain at the bedside and there are some silver metallic circular restraints on them, that's a clear sign that that patient could potentially be violent. All right, so let's look more closely at observing our patient for physical signs. Anxious. I like to think of it as the triple A, and think of anxious, agitated, and angry. And we could look at that as levels of hierarchy. However, a patient who may just appear anxious could also become potentially violent, just as someone who's overtly appearing angry. Okay, so anxious, we think of someone who appears tense. They have pursed lips, their knees are flaring, they may be clenching their fists. Something that may let you know, I really want to get out of here, or I'm really unhappy that you're not meeting my needs. An agitated patient, they might be exhibiting repetitive words, repetitive actions. Something I probably didn't think about throughout my life is something that may appear someone agitated, someone who's pacing. And pacing in a way that they can't control, can't stop the behavior. Okay, it's something they may be doing to calm themselves down. That's another clue. And lastly, of course, someone who appears angry. They're obviously talking loudly. They may be yelling. They're saying things that are threatening, but they're not always loud. Sometimes if you listen to the words that someone's saying, they sound like they're blaming the health professional, blaming a family member, blaming someone for whatever's happening in their life, and it's always someone else's fault. Those are also clues. So let's look at planning. So the main thing we want to plan for is a safe environment for all of our patients, but particularly those who could become violent. Let's look at the environment. So on this slide, a lot of hospitals now, the newer hospitals, everyone has private rooms, and ERs older and newer, many times they're built with quiet rooms. Okay, so if that's a possibility, have the patient in that type of room. Most hospitals also have policies on what to remove from the room if you think your patient could potentially become violent or hurt themselves or others. Know what those policies say. Let your preceptor know, hey, can I take a moment to step aside and review policies? And from there, they usually direct you on what to look around in the room, to remove from the room. So look at the furniture in your room. Even a stretcher, a nearby stretcher, if you're escorting them in the hallway, could be flipped and become a projectile. Also, of course, look at any sharps that are in the room. Sharps boxes are almost never in a room with a patient who's potentially violent. A portable medical device, IV pole, the IV monitor, and any cords affiliated with any of those things. Those can all become weapons at any point in time. The next thing you want to look at is the space that you are leaving between yourself and the patient. A normal human interaction, it's pretty common that 18 inches is considered adequate personal space. Now, for an agitated patient, angry patient, you want to think twice about that, and when I say think twice as far. And now with COVID, everyone must remain 6 feet apart. So at the current time, but think about 3 to 6 feet away from the patient when it's non-COVID times. Usually, of course, if we have to take vital signs, provide medications, or otherwise care for the patient, you'll temporarily go closer to the patient and then quickly get back to the 3 to 6 feet. But one of the most important things is make sure the patient is not blocking your exit to the door, and that you're not doing so for the patient. So even if you have to talk to the patient in the doorway, make sure you're doing so in a manner one side or the other. Let them know you're just stopping in, either to check on them or to address their need at the time. Okay? In all the circumstances, respect the patient's wishes and just try to be as accommodating as possible and let them know you're still there for them, but you are the one that's in control of maintaining that safe space with the patient. Choices. Patients want choices. Patients have a right to have choices. If the circumstance allows, let a patient know there's a physician order for this, and if you want another accommodation, you'll talk to the physician about that. One thing I want you to make sure you stay away from is choosing for yourself between two patients' orders. If you ever see a physician order where they allow different parameters and the nurse is to choose based on the situation, just remember that's always a no-no. Call the physician and ask for an alternative treatment if in fact that's what you see, or the patient even tells you that's what's best and that's what works best for them. So truly listen to your patients. Okay, so in summary, please be conscious of the fact that patients are here, they're either sick, they're either scared, or they're in crisis. And in the rare circumstance, they might be experiencing all three. And make sure that in our compassion, one of the things, knowing your limitations. As a first-year nursing student, know your limitation. Talk to your preceptor. If, once you look at the history and what you're observing from the patient, you feel that on that particular day, you need to take less patients so you can focus on that one patient, make sure to do that. Okay, continually be assessing, continually be planning, and then implementing and evaluating how well you're meeting the patient's needs. We as a healthcare system are meeting the patient's needs. And that's how we show compassion in our critical thinking that we're doing for the patient, and ultimately respecting the patient's rights, even those who could potentially become violent. So please, our next session, we'll talk about interventions and how we implement them and evaluating how well the patient is responding to those interventions. Okay? Thank you for listening.